On the vlog today, I'm delighted to be talking to Peter, a leading cancer specialist in Estonia with more than 25 years of experience. Peter, I wondered if you wouldn't mind just introducing yourself quickly, a little bit about your employment, give us an idea of your experience.
Hi, I am Dr. Peeter Padrik. My professional specialty is oncology, where I have worked almost 30 years now. But currently I work as CEO of health company Antegenes. And my previous experience is from University Hospital, which is Tartu University Hospital. But now I'm more in health tech.
Yeah, interesting. And we'll dive into that a little bit in a moment. Before we do, what is it about your role as an oncologist that you are most passionate about?
Of course, my main professional passion is to give to my patients more life. And from one side, this is for my patients who already, unfortunately, have cancer. But now I have moved more and more also to the prevention of cancer using new innovative technologies for that. And if we can prevent cancer or eliminate cancer as early as possible, we can give people significantly longer lives. That's my main passion.
Wired, the tech publisher, I don't know if you're aware of them, ranks Estonia as the most digital nation on the planet. And I wonder, does that filter down into national healthcare? Can you tell us a little bit about what digital looks like in Estonia and how that might be different to other countries? And does it include electronic health records, for instance?
I don't know that this is so much different because computers are used everywhere. But what is true that all our health records are digitalized. So principally we can work paper-free. And this is much more efficient because you can organize all processes more quickly, and much more information is available and applicable in practical healthcare using digital tools.
When did Estonia fully shift to electronic health records?
This has been step by step. I think that one such big step was in 2008. Several applications have also added, and this is such continuing process actually.
So do you see incremental improvement to the efficiency of work and patient outcomes? Does it feel tangible to you?
I personally absolutely feel that this is much more efficient because my processes, even not such medical processes, but such administrative or routines with patients, they are much more efficient now. And of course, also much more information is easily available about the patient, previous diseases, previous conditions, and so on.
Yeah, basic but essential stuff. So what did the pandemic change for you in terms of work, or if anything?
Like everywhere, the pandemic created new norms or new practical rules. But we still have to manage previous problems and diseases like cancers and also provide cancer prevention. One practical change that has happened is that web-based or digital consultations of patients are recognized officially and are in much more broader use as previously.
And this is quite a broad question, I admit, but what role do you think digital should play in health?
Digital plays so many roles. I have to say that computers, if to think, then the computers are the main working tools in healthcare already. Of course, if surgeons operate or any other such practical medical processes are performed, but even there, computers take more and more role. So absolutely, digital is everywhere in health.
Do you think that digital will play an increasingly bigger role, post COVID or during COVID, whenever we, are fully released from the virus's grip?
Yes, of course. This is more relevant now, but maybe even because of such technical or professional functions, but because of all communication is much more virtual as previously. That's the main impact.
Yeah, so more about the consultation than the way it might have affected treatments or anything else, I guess.
Yeah, exactly.
Peter, you founded your genetic testing company, Antegenes. Could you tell us why you started it and a little bit about your vision there?
I started Antegenes because I saw that a lot of new genetic information is not yet in use in healthcare. And my aim with Antegenes was to implement this innovative genetic information into precision prevention of most fairly common complex diseases as cancers and cardiovascular disease. And if to be more specific, then we use so-called polygenic risk score technology to characterize individual genetic predispositions for diseases to implement accordingly so-called personalized or precision prevention. And this is already, we can say that our everyday practice. And of course, our such final aim is to reduce the impact of these common serious diseases and people live longer and healthier lives. That's the aim of Antegenes.
So would you say that the focus is more on prevention as cure? Where do you see Antegenes kind of having the most effect?
Exactly. There are a lot of activities in the field of therapeutics on the basis of genetic information. But from other side, it's better to avoid the disease or detect this as early as possible. And we have this information in our genes, which we can use for these purposes.
Yeah, so you've got expertise in breast cancer prevention and early detection. Apart from the genetic testing that you're providing, do you see any other digital interventions that could be used, in conjunction with that testing?
Actually, we are using combined genetic and digital technologies to characterize personal risks of breast cancer. And after this risk characterization, we use personalized screening, where we have again digital technologies in use. And even after that, and between that, the communication between doctors and patients is more and more digital, which telephone is much more efficient. But of course, when a real physical examination is necessary, then this is indicated and necessary. But the role of the real physical examination is, in my opinion, smaller as previously, as digital diagnostic technologies are better and better, and we can see into patient's body inside with digital technologies, what we cannot do with only physical examination.
The kind of it occurs to me that the ecosystem, will kind of change a little bit, and as part of that ecosystem, what do you feel that the role of pharma and life science more generally should play in assisting better patient health outcomes?
To achieve better patients' outcomes, we use massively more information as previously. And this is not possible without digital technologies. For example, genetic analysis. In our breast cancer test, we use 2,803 points in our genes to characterize personal genetic risk for breast cancer. And it's absolutely clear that it's not possible to do without digital technologies.
In terms of I guess, pharma and life science again, and the companies that provide you with products and services, how do you want them to communicate with you? How do you want them to add value? What does it look like to you?
Every morning I get tens of emails from biotech and pharma and from various other sources where information is sometimes summarized better, sometimes not so well. So it's very difficult for me to say how all these things should develop, but currently I feel that we have plenty of information available.
Actually, so you're suffering from a kind of an
sorry, from your attitude, how you think yourself and how you try to use this information as well as possible.
So you have to sift through the information to kind of work out what's most valuable to you, I guess.
Yes, there are very different informations available, and of course, such objective information is the best.
Yeah. So final question, if I may. So in terms of obviously what the pandemic did do, it was restrict physical meetings, right? Now, obviously within oncology, there's some really big meetings such as ASCO. What do you need and want in terms of that ability to provide yourself with further education and networking with colleagues? What does that look like now in a kind of COVID world?
Most what I miss is actually the time we previously booked for meetings. So during meetings, you went outside from your everyday routines, or everyday work. You booked at that time already 1 year earlier. And now if we have virtual meetings, then it's very difficult to plan your activities because it's so everyday routines, they are easily disturbing these virtual activities. And that's my main, maybe my personal problem.
Okay. So is that networking is the bit that's and kind of, you know, real connection with your peers, I guess, is the bit that suffered.
Yes, and probably we should need new formats and new routines in these virtual conferences also, because I see that quite often they are organized on the same way as old on-site meetings.
Right.
You have presentations, and current conferences, they try to mimic somehow on-site conferences, but probably virtual conferences need new formats to do that, because it's different.
Yeah, there's probably, I don't know how appropriate this is, but there's probably an analogy here about publishers in general. So from the previous kind of, you know, pre-digital world, and then just putting content straight online, and it hasn't quite worked. It, you know, it's a different medium, and it calls for a, you know, a different set of rules. But yeah, thank you very much, Peter. That has been, you know, really genuinely very interesting. It's great to get your opinion as an oncologist, as an Estonian oncologist as well, as an expert with your own company that is, you know, looking at precision medicine and personalized medicine. I think that's, you know, that adds a very unique flavor to your answers.
Thank you very much. It was very nice to meet you and discuss these things. Thank you.
Cool. Thank you very much, Peter. Take care and have a good one. I'll speak to you soon.